we're going to work on some seated hip rotation and knee rotation, isolating the two and just observing what we feel. Now, I just assume that you've already put smileys on your knees, so if you didn't, please go ahead and do that. It's really essential. Okay, cool. So what I'd like you to do, comfortable seated position. You could be on the floor if you'd like. Go ahead and bring up that left leg just a little bit. Now, we're going to turn our smiley like that. That's external rotation of your hip. You can move the right leg out of the way if you've got a lot of rotation. Rotate, return. Rotate, return. I want you to think about a couple things. What are you feeling, particularly on the inside of your leg? And with this smiley face, we want it to rotate on an axis, but not move up, down, side to side, or diagonally. So it's rotating, but it's staying, it's taking up the same space. Observe what you're feeling. You can guide with your hands a little bit to get a little more feel. How far can you get that to rotate? And then see what you can do actively without the help. But the guidance is pretty helpful. Ooh, we got a little crack there. You can set that down. Let's try the right leg. Switch this. Bring that right knee up. Rotate. What are you feeling? Is it easier or harder to keep that smiley in the same spot as you rotate it? All good things to think about and observe. And by the way, this is like number 7 on the list of things to do in public. Seated rotation, adding the head with it, preferably making eye contact with a stranger. It's really endearing. You'll make a lot of friends. Set this down. So I want you to observe what you're feeling side to side. Now, before we move on to internal rotation, I want to work the knees. So at this point, we want the smiley to stay nice and still. You're going to flex your toes up on your left foot. See if you can rotate your shin externally and internally. Okay, so your shin is moving outside of the smiley. The shin is moving inside of the smiley, ideally. Towards the outside, towards the inside. As this happens, if it's challenging, you can use your hands to guide in and out. Encourage a little bit more movement. And as you get a feel for it, I now want you to shift your focus to the muscles that are working. You're likely going to feel your ankle trying to pull that shin along. What I'd like you to do is shift more of your focus to these muscles behind the knee and in the thigh. So as you rotate externally, you're going to feel all these tissues fire up. See that? As you rotate internally, you're going to feel more underneath the knee and on the inside of the leg. So I want you to focus on feeling this more than the ankle. Initially, that might be challenging, but I just want you to hone your focus more on the thigh than the ankle. And observe how far you're able to move. Always want to be pain-free. Let's go ahead and switch now to the right leg. That's pretty fun, right? You got another leg. So now, pull the toes up, create some tension through the front side of the leg. Smiley doesn't move. It's just observing what's going on. Rotate externally. Rotate internally. As you go, the skin might move a little bit, so you might get the smiley stretching slightly, but it's not turning and it's not rotating. Same deal here. Observe. What are you feeling differently on this side, if anything at all? Maybe it moves more or less. Maybe you feel a little bit more or less stable. How easy is it to get in touch with these tissues in your upper leg behind the knee? And how much does your ankle want to help? So observe that point at which your ankle wants to start to help. Okay, and that's when we really want to focus on these tissues here to do the work. Yeah. And the smiley's just watching it all. Now, we're going to work on hip internal rotation. So, boom, now the shin stays still again. We're going to lift up the left leg. And now, we're turning the smiley like that. There we go. So same rules apply here. No pain. We don't want to push through any pain. We want to keep that smiley rotating on an axis so it's not sneaking in, out, up, or down. There we go. How far can you get? How does that feel? Nothing's changing here. All right, you're going to feel probably the tissues, glutes, outside of the hip a bit, trying to help you with this rotation. Observe if that ankle wants to get involved again. Sometimes it's going to pull. Try to focus most of your effort out here. Relax, and let's switch up. Let's go to the right. Okay. Rotate. And return. Rotate that smiley. And return. Observe what you're feeling. Observe which of your friends here really want to help the most. And try to encourage these friends to help more than those. These are all very technical terms, I understand, so just bear with me. Again, we're not pushing through pain. Torso doesn't change. There we are. Last thing we're going to work on is a little bit of a relaxed rotation for the knees. So I want you to now relax your feet as much as you can, so you can just glide them easily along the floor if you're able. Oh, we got a little pop there. Okay, if you don't have a surface where you can slide your feet easily, you can also go one at a time and just kind of relax and drop your foot and see how much rotation can I get if I keep this lower leg totally dead. Well, it's still alive, it's just not active, it's napping. Okay, lower leg naps. The smile's just watching. How much rotation can you get? How does that compare to when we were flexing? Relax, let's try the other side. Same deal. So now, this is gonna make you focus quite a lot more on these tissues right where your hands are. Feel what's going on there. Sometimes even squeezing. I can kind of squeeze the bottom of my leg really hard, and then you're really going to feel who's working there. Okay. You can relax. Great work. I hope you gained a little bit more awareness and learned about smileys. Thanks for joining, and as always, don't forget to smile.